People from across the country tell us a Queens-based business is charging their Medicare accounts for supplies they'd never ordered or received. And records show Medicare is coughing up tens of thousands of taxpayer dollars. Investigative reporter Tim McNicholas first uncovered this pattern more than a year ago and has this report.
You ever been to Queens?
No, I've never been to New York.
Nope.
Have you ever heard of Almaz Med Supply?
Nope.
Linda Christensen, Catherine Hensley, and Jenny Kiefer all say they've never needed anything from this medical supply store on 69th Street and Queens Boulevard. So imagine their surprise when they discovered Medicare claims in their names for thousands of dollars worth of orders from the store.
It must have been like, what the heck is this?
Yeah, I don't think I said heck, but yeah.
The women from Pennsylvania, Florida, and Maryland shared Medicare account records with us, showing Medicare paid the store $13,000 between March and June, $6,300 between December and April, a separate $6,300 payment in January, all for wound dressing, glucose monitors for diabetes, and catheters that they say they never received. Not that they ever wanted them.
Do you have diabetes?
No, I've never had diabetes.
The question that comes into my mind is, how did they get my Medicare number and how did this get through?
Claire Rosenzweig of the Better Business Bureau says her team has fielded 8 other similar complaints about the company since last fall.
Do you have any theories or insight as to how they could do this?
All of our personal information, unfortunately, is out there, and sometimes it's hacked. There's the dark web. There's so many ways that fraudsters can get a hold of personal information.
Last year, a CBS News New York investigation revealed another New York City business billed Medicare for millions of dollars worth of catheters that patients never requested. The federal government says Medicare fraud, errors, and abuse cost the U.S. Department of Health and Human Services $60 billion per year. The Trump administration has repeatedly said it's working to eliminate various types of fraud, but HHS and its secretary, Robert F. Kennedy Jr., did not respond to our interview request for this story. Neither did his predecessor, Javier Becerra.
If there was a way to notify me and say, hey, Mrs. Kiefer, sorry to hear about your diabetes, I would have said, what are you talking about?
State records show Almaz Med Supply is registered to a Zurab Satchkalashvili. Someone with that name listed a Brooklyn apartment building as their address last year in an unrelated lawsuit, so we visited that building.
Hi, is this Zurab Satchkalashvili?
Yes.
Whoever answered let us in, but no one answered the door, so we tried the call box again, and the man then said he knows nothing about Almaz.
Hello.
Is this Zurab?
I'm not Zurab. I'm not Zurab.
You just said you were when I called earlier.
Yes. I'm not Zurab, man.
And no one answered the door or the phone at the store. No surprise to Mohammed Sarder, who lives 2 doors down.
They open probably like 3, 4 years, 5 years. I'm not sure exactly how long.
And in that time, have you ever seen anybody going in and out of there?
No, I didn't see it.
Nonetheless, Almaz is gaining nationwide recognition.
I was pissed. Outrageous.
For all the wrong reasons.
We also tracked down a man who said he sold Almaz Med Supply to Satchkalashvili last year, and then he says he started learning about fraud allegations soon after. He would not agree to an on-camera interview and directed us to his attorney, who never returned our calls. But Jessica, in our previous story last year, same pattern. We found multiple businesses that had recently changed ownership or management and then had complaints about fraud.
This might be a lofty question. Is there any way for Medicare to get those payments back?
So HHS told us in an email for that story last year that they do have some ways of clawing some of these payments back. And just because a claim may publicly show up as paid, they say it doesn't necessarily mean the money went out the door. But sometimes it does, hence the $60 billion in annual losses from Medicare fraud and errors. $60 billion.
Yeah, that's a staggering figure.
Yeah.
All right. Great reporting. Thank you so much, Tim. Tim is one of our investigative reporters. If you have a story for him or our investigative team, scan the QR code at your screen. That story may end up on our air.